Okay, so I'm gonna give you a little bit of instruction about the 9-hole peg test. So are you right hand or left hand dominant?
Right hand.
Okay, so you're gonna have the dish on your right side. And the aim of the game is to go as fast as you can. You're going to pick up the peg, put it in each hole, and then when you go to remove them, so you're gonna line them all up, and when you go to remove them, please remove just one at a time, not scoop them all up and put them in the tray.
Okay.
I'm gonna give you a practice round for each side. So right hand, we're gonna practice, and then we're gonna time it again for the real deal.
Okay.
Can I ask you a question really quick?
Go for it.
A couple questions that came up were, what happens when they're going so fast and the pegs fly out and hit the floor? Do we start over?
Time keeps running. You just help them back up the pegs, because that's showing like we're going a little bit too fast. We don't have the sufficient control of like following directions. So it might be a cognitive issue that might be going on.
Okay.
So you can stop it again, redo it, kind of explain. You're doing it as fast as you can, but making sure it's not going to go fly everywhere. You might have to modify yourself as time goes on, but usually I have never had somebody like that has had all the pegs fly out.
Okay.
Sometimes like one will like slip down and like, okay, I'll grab it as they're like putting the other ones in.
Yeah.
It's not that big of a deal, but definitely like if it's a very obvious, like they didn't pay attention to the questions, they're like grabbing them all at once, that's something that you would want to stop fully and try again.
Okay, got it. And then does it matter if the pegs are in order, like first or second or third row?
It does not. That is completely fine. And also right now you have, like, I'm going to use my phone as like an example because I have my practice here. You want the dish to kind of be on their opposite side. So if you're testing right hand first, it's going to be the dishes on this side. They almost have to cross midline, so they're doing this.
Oh, so I had it right the first time. Okay, so I was just watching back your video, and I think I got confused on that. So I'm glad you said that. Yeah. So yes. Okay. So right hand, dishes on the left side. Just reaching. Okay, crossing midline.
And then when you got the left hand, you flip it to the other side.
Got it. Okay, thanks. Probably should have asked those questions before we started. All right. So now we know dishes on the right side. So pick up individual one, put it in the hole, take it out, take each one out individually. And then when you pick up the first peg, I'll start the timer. So when you're ready. Okay. Nice. Right hand practice, 21 seconds, 97th of a 100th.
The other thing I want to just mention, not all clients will need to do this. Some are completely fine just doing it with one hand. I will sometimes just let them know if they need to. They can use their left hand. So you're testing right, they can use their left to stabilize the pegboard. You kind of see how it's got like the little divots that like stretch out?
Yes.
That's where a client can put their hand to stabilize the board if they've got nothing underneath it.
Okay.
Type of deal.
Thank you for reminding me. We just did the practice before, so that was just mentioned prior, but I did not say it for this presentation. So yes. And we talked about the stabilization, so left hand, and then I offered her Dyson, and she declined. So we're good. Yeah, thank you.
Yeah, that's completely fine. It's just something to always keep in mind, like having it in your script almost.
Okay. All right, when you're ready for your real deal. Okay, we're going to do the left side practice. We're going to switch the board. You can stabilize with your right hand over here. And then let me know, or I'll just watch you when you're ready. Right? Okay. Nice. All right. Nice. You shaved a couple, about a second or 2 seconds off of each one. So, is it okay to share with her about your left eye? Okay. So, what I think is really cool is we were looking at the standard deviations for females before this, and I did it on another classmate. And so, their age range was like very much correlating with the score that they got. But Alyssa actually said that she has arthritis in her fingers, and her scores have been slower than the mean. So I thought that was really interesting. So
I do have a question with that left hand. Did you notice how she was grabbing the pegs?
Was it like tip like this?
I don't know.
I did not. I wasn't aware. I would love to know.
Kind of get with practice. So let me find myself something I can. Okay, here we go. I have a pencil.
Okay.
Not the same length or anything as the peg, but when she was putting them in, she was grabbing it with 2nd through 4th and the first one on it. So this isn't a superior grasp of any type. Usually when we think of our fine motor, that is our index, our middle, and our thumb working together. And when she was taking them out, the index finger didn't even come into play. She was doing this.
Interesting.
Thumb, middle, and ring.
Interesting.
So those are some of those notations that you want to do when you are doing an assessment with a client on what type of grasp they're using. The most superior way would be tip to tip, using index and thumb, like this. If they're using these 3, that's completely fine, because these are the 3 that we use for our fine motor dexterity. Now, when you start seeing some funky stuff, and you will see some funky stuff, because I have somebody with their pinky and put them in, and I'm like, all right, took them out, you did what I asked you to, but you definitely used not what the proper grasp is. Those are different things you want to note take. And of course, prior, want to make sure, like, just like, why are you here? If you're having any pain, like, what could be maybe preventing you from being able to complete this assessment, or just kind of like the background things that you want to know. And you can even ask them after, like, how did that feel? Was there any pain while you were moving those pegs? Did you feel slow at any moment in time? Like, you want that subjective stuff to make a bigger picture of like what deficits the client is having.
Awesome. That's very valuable. Thank you so much. Instructions. You have to listen carefully, okay? You are going to use your right hand first. First, we're going to practice. It's a speed game, so you get to go as fast as you want to go. I know you're excited. So hold this down with your left hand if you need it to keep the board very still. So pick up only one piece at a time. Wait till I say go. And then when you fill up the whole board, you take one out one at a time. Because earlier, remember, you were scooping them all up? Okay, only one at a time. Okay, if it happens to where he gets this real excited and he's like grabbing them all up, what should I do?
With a peds patient, I have never done this test on a peds patient. I'm going to be honest with you, this is also new to me.
Okay.
So
we're just
making
gonna
sure
wing
that
it.
we're listening one at a time, one in each little hole, just kind of going through it. It's something that you can definitely put into notes of how well your patient is following along with instructions. If you're having to explain a couple times, you're probably cueing a little bit more than you would with an adult.
For sure.
So definitely experience. You're a little braver than I am, because I've never done this one with a peds patient.
I don't know if it's brave. Oh, we're pretty brave. We got this.
This
Okay.
is something appropriate to use with the pediatric population, because per assessment rules, you can use it from like ages 2 all the way up to 99. So it's completely appropriate to use. It's probably not the main one that's used when it comes to fine motor dexterity for children. There are other different tests that kind of encompass everything at once, which is more of like what we do in a pediatric sense, just because it saves us time. We're not looking at each little nitpicky thing. We need a big picture as quickly as possible, just because a lot of our peds patients will lose focus really fast.
Yes. We're about to have a real life example. Maybe not.
He's ready, I think.
He's right. He looks really ready. Okay, so.
I'm looking at the board like crazy.
Okay.
I'm sure you're gonna do it with flying colors.
I'm gonna watch you, and when you start and pick up the first piece, remember just one at a time. You're gonna do your right hand first.
I'm going to take seconds on that.
This is a timer, so I'm gonna see how fast you can do it. Okay? Okay, so when you pick up the first piece, I will start my timer. Okay. You're doing great. Keep going. One at a time. There you go.
Yeah. Uh-oh.
Now your left hand.
I can go loud.
You're doing good. Okay, you're about to start taking them out one at a time. There you go. There you go. 1, 1, 1. Good job, Harry. Nice.
Okay.
How many seconds was that?
Super fast, 27 seconds. Okay, that was just your practice round. So you're going to do it the real deal this time, and I bet you your time is going to be even faster. No, it's still recording. Okay, all right, here we go. So now we're going to do it again. Same thing. When you start, I will start the timer. Okay, go. It's okay. It's all right. It happens. Try to go not so fast that they're falling out, just one at a time. So, like controlled, slow and controlled. There you go. There you go. Good job, buddy. It's all right. It's a runaway. Nice job.
Was that longer or shorter?
It was only an 1/8 of a second longer.
It's still pretty good.
So pretty good, pretty amazing.
Still pretty good. And you had one that flew away, but you managed to get it back in, so that was awesome.
Did good. Okay,
That's like one.
flip your board. We're gonna flip it. So now, what hand are we gonna do now?
Just like you mean, I thought you meant like.
Oh yeah, no, we're not gonna dump it out. We're just gonna turn it. Okay, what is the hand you're gonna use now? What is this?
Your left hand.
Your left hand. Okay, so it's the same thing, one at a time, fill up each hole as you go, and then when it's all filled up, take one out at a time. Slow and controlled. You want to go fast, but you don't want to go so fast that they go all over. Okay? All right, when you pick up the first peg and put it in, I will start the timer. Wow. Doing good, buddy. And one at a time out. Yes, very good.
How's that?
It was very fast. You are right hand dominant, but that was a very quick left hander you had, buddy.
Was that more? Was that way
It
more?
was less than the other side. You did it very controlled and very
Because
precise.
I'm kind of, even though I don't use my left hand a lot.
Yeah, you did it pretty fast on that side.
Okay, so that was the practice round, and now we're gonna do it again to
That
watch
was
how you.
That was a real practice round again.
We're gonna practice again.
Okay.
2 practices. Okay, but we are using our what hand?
This hand.
Okay, hold the board.
I'm ready. Ready on. Ah.
Wait. Put your peg back. Let me start.
Ready.
Okay.
Set.
Keep going.
Left hand. Okay, one at a time. One at a time. Take
And
it
I
out.
gotta get back to the dish.
Left hand.
Now, if this was with a real patient, that's also something
Is that
that you
good?
can take.
Yes.
That they had that blip where we are
Mommy,
using
was that
bilaterals.
slower than last time?
But it's something definitely that, in a Pete's case, I would almost not want to do it again just because now we're getting to the point of it's becoming too repetitive. We're starting to get a little bit bored. We're twitching a lot more in our seats. With an adult, you can go ahead, just redo it. Like as soon as you saw that they went bilateral and you're as well, like with correction, they can redo it and do it correctly. I would go ahead and do it. Sometimes, let's say with the stroke population, that is something that you want to consider if it's more of that cognition area. If they're going to become frustrated on having to do it again, don't do it again. Just make sure it's down in the notes.
Interesting. Yeah, I like how that's very like client centered. You don't want to bring them to the point of agitation.
Yes,
Yeah.
because sometimes you will have some clients that can verbalize when they're agitated.
Yeah.
Because I have had that happen before with a different fine motor test where it's like I had a client tell me like I'm getting agitated, I need a moment. Perfectly normal.
What do you?
But sometimes
How do you
in
handle
that case,
that in the
I
real
might
life?
I just straight up said, okay, sounds good, we'll take a break, and we just started talking about our pets until he was ready to continue. Because I had the full hour for an evaluation, and I was completely fine letting him like de-stress and just, you're completely fine, we can move on. And it'll almost be in a way the same thing with your pediatric clients. Like, for example, you had your big old test like the Peabody.
Yes.
It's very long, it's very hard. You are almost keeping up with your pediatric patient. Like, if they're moving an inch forward, you're moving that inch forward with them, type of situation. It's not at all like you have to do everything cookie cutter. It will sometimes be like if you've got to jump around and do a couple things, you're jumping around and doing a couple things. So same here, it's like you were almost like putting your hand over his to keep one side steady. That's completely fine to do in this case, just to make sure that he's knowing like we're using one hand right now, not both. So that was perfect to do. Definitely when you were doing this with your colleague, of course, with your peer, was a lot more professional because I mean, clearly different situation, different everything. With your child, you have to be a little bit more relaxed, and that's honestly how adults and peds go. So that was perfectly fine how you switched the two. Cueing wise, definitely I want you moving forward, especially when you're doing it with adults, model it first. Even if it's just doing a row, but definitely model how you're doing the assessment.
Got it.
Like, just take a moment, explain like, this is what I want you to do. You're going to take one at a time, and as you're explaining it, you're actively doing it.
Got it.
So definitely something to keep in mind. Demoing is going to help a lot because like sometimes people are going to be more visual learners, and you want to facilitate that success during the assessment. Cueing wise, anything else from there? I've got nothing else. Just making sure well's on the side that you're testing. Well's on the side that you're testing. And that's pretty much it. The 9-hole peg test is a nice, quick and easy in and out assessment that definitely saves us time and gives us a very good picture of where somebody might be. And then of course, if with your peer, I did like how, again, you asked her like, okay, what side are you dominant on? Make sure that you are noting that, because for your documentation, that's pretty important, of like right hand dominant or left hand dominant. And also, like, if you have a genuine patient, you're asking them like, oh, how are you feeling today? Like, what side's hurting? What's being the problem? You want to have that background information before they start, because like, as you noted with your classmate, like, because she has arthritis, she does move a little bit slower.
Which I thought was so interesting. It was definitely like textbook edition, like very real life, which I thought was cool.
So those are just things that, like, in documentation wise, you want to put down as like the objectives, the subjective stuff that a client's telling you before you take your objective measurement of how long was the 9-hole peg test.
Okay. Thank you so much. Thanks for meeting me again today.
Of course.